Transforming healthcare, Jasmy's blockchain and IoT solutions for a more efficient, secure and patient-centric system. Healthcare administration, bureaucratic processes. The solution mentions the PDL, but doesn't explain how blockchain fundamentally improves security and accessibility over traditional systems. Adding that blockchain ensures data integrity by preventing unauthorized alterations could strengthen this point. Patient data management. The solution is well-rounded, but emphasizing that blockchain provides a single source of truth which can eliminate discrepancies across systems would clarify its impact. Staff training and retention. The solution could benefit from explaining how decentralized credential management through blockchain reduces administrative overhead, making continuous education more seamless. Clinical care and patient services, access to care. The solution could be more explicit about how Jasmy's platform ensures data security during telemedicine sessions, reassuring readers that remote consultations are not only accessible but also secure. Patient-centered care. The idea of giving patients control is strong, but elaborating on how this control can directly influence treatment outcomes by ensuring accurate and up-to-date information is always used could be beneficial. Continuity of care. Mentioning that Jasmy's blockchain allows for real-time updates to patient records accessible by all authorized providers could highlight its efficiency in maintaining continuity. Healthcare IT and security, cybersecurity. The mention of decentralized ID systems is good, but explaining how Jasmy's technology protects against common cyber threats like phishing or ransomware could make the solution more relatable. Interoperability. Clarifying that Jasmy's blockchain enables standardized data formats across different IT systems could underscore its role in facilitating seamless integration. Patient privacy. The solution should emphasize that patient data is encrypted and accessible only through patient consent, further reinforcing trust in the system. Pharmaceutical manufacturing and drug development. Drug pricing, transparency. The solution should clarify how blockchain's immutability ensures that pricing data cannot be tampered with, fostering trust and transparency in the pricing process. Supply chain management, mentioning specific examples of how real-time tracking can prevent counterfeit drugs from entering the market, would strengthen the argument. R&D efficiency. It would be helpful to explain that AI integrated with blockchain can accelerate data analysis, leading to faster identification of viable drug candidates. Healthcare insurance, cost containment. The solution could be enhanced by explaining how blockchain reduces administrative costs, which in turn could lower insurance premiums. Fraud prevention, mentioning specific types of fraud that blockchain can prevent, such as duplicate claims, could make the solution more concrete. Insurance coverage gaps, clarifying how lowering administrative costs leads to more affordable plans and potentially wider coverage could connect the solution more directly to the problem. Healthcare policy and regulation. Regulatory complexity. The solution is strong but could benefit from a mention of how blockchain's auditability simplifies compliance with regulations, reducing legal risks for providers. Public health initiatives. Adding that Jasmy's platform can securely aggregate data from various sources for better public health insights would underscore its utility. Health equity. It would be useful to mention how Jasmy's platform can help track health outcomes across different populations to ensure equitable care. Medical device, manufacturing and regulation device safety and efficacy. The solution could clarify that blockchain provides a tamper-proof record of all testing data, which can streamline the approval process. Post-market surveillance, mentioning how real-time data collection from devices can quickly identify issues, could make the benefits more tangible. Innovation and accessibility, explaining how blockchain reduces costs by improving supply chain efficiency, could strengthen the point about making life-saving devices more accessible. Healthcare facilities and infrastructure facility maintenance and upgrades. The solution should highlight how real-time monitoring using IoT can prevent costly breakdowns and ensure patient safety. Emergency preparedness. Emphasizing that Jasmy's platform ensures that emergency protocols and resources are up to date and easily accessible could enhance the argument. Patient flow management. The solution could benefit from explaining how real-time data allows for dynamic resource allocation, reducing bottlenecks in patient care. Healthcare education and workforce development, medical education reform. The solution could clarify that blockchain ensures the integrity and availability of up-to-date educational resources, directly improving the quality of education. Continuing education. Explaining how Jasmy's platform can automatically update training materials and certifications in real time would highlight its practicality. Workforce diversity. The solution is strong but could benefit from a mention of how data collected on workforce diversity could be used to develop targeted retention programs. Healthcare marketing and public relations. Transparency in advertising. The solution is well covered, but could explain how an immutable record prevents misleading claims from being made in the first place. Patient education. The idea is strong, but adding how personalized content can be delivered securely via blockchain might better highlight the platform's utility. Community engagement. The solution could benefit from a real-world example of how data-driven insights have improved community health outcomes. Healthcare supply chain. Efficiency. The solution should emphasize how real-time tracking reduces delays by quickly identifying and addressing supply chain disruptions. Cost control. Mentioning how blockchain's transparency could lead to more competitive pricing in procurement would enhance the argument. Sustainability. Clarifying that blockchain can track carbon footprints and encourage eco-friendly practices could better connect the solution to the problem. Healthcare fraud and abuse. Detection and prevention. The solution is robust, but adding how AI can predict and prevent fraud before it occurs would make it more compelling. Accountability. Explaining how blockchain's audit trail can simplify investigations and lead to quicker resolutions would strengthen the point. Patient and provider education. The solution could be enhanced by mentioning that ongoing education on fraud prevention can lead to a culture of vigilance within organizations. Healthcare research, funding allocation. The solution is strong but could benefit from a mention of how transparent funding allocation can attract more stakeholders to underfunded areas. Clinical trials. Adding that blockchain ensures that trial data is tamper-proof and accessible to all stakeholders could strengthen the solution. Ethics in research. The solution is well covered, but mentioning that Jasmy's platform ensures that patient consent is always up to date and respected could reinforce trust. Healthcare payment systems. Billing transparency. The solution could clarify that blockchain simplifies dispute resolution by providing a clear, immutable record of all billing transactions. Payment models. Mentioning that Jasmy's platform can automate payment processes based on predefined outcomes would emphasize its efficiency. Insurance reimbursement. The solution is strong, but could be enhanced by explaining how blockchain can automate and expedite the entire claims process, not just tracking.